So I am sitting here in my office in my chair where I sit many hours a week and wanted to give you kind of a little description of part of what we'll be doing, which is we have a whole spectrum in terms of releasing and managing stress from very subtle movements and use of breath to very gross movements and use of breath. So when we're sitting with clients, it's obviously a little more difficult to use which can be very useful at other times. But how we have to be a little more contained and controlled not to spook our clients. So, nonetheless, the breath and small micro movements are also really useful, keeping stress from accumulating. So, I'm going to pretend I'm sitting with a client who, let's say, has having a trauma memory, so it's stressful for them, and for whatever reasons, it's proving some stressful to be stressful to me. So I'm going to notice. I'm going to pretend. Well, actually, I feel that there's tension in my abdomen here. So I notice that the tension there is also translating into a constriction in my breathing. So first thing, noticing that, I'm just going to breathe more deeply into my belly, kind of conscious. I'm breathing already, so might as well do something with this. I'm breathing more deeply into my belly. Right, and noticing that the tension that was there starts decreasing. I also notice other things from that, which come from states of relaxation, which is a greater sense of presence, a greater. I can imagine a sort of greater connected with this, my imaginary client, and yet I'll say that it's often the case the full amount of stress isn't released. So I notice a little bit sort of still in there, and so still listening to my client, I'm just I'm just moving a little bit. I don't think you can see it. I've never had anyone point to me and call me out on these small movements. What are you doing? So it's pretty innocuous visually, but nonetheless, I'm moving in these small figure eights, and it's not really planned. It's just the intuitive. It's like listening to the body and noticing, and then experimenting with what actually helps release the tension. And sure enough, I notice it relaxes, and it's kind of soothing at a body level. So there's all sorts of things to experiment with these small motions, and they're very, in a sense, they're very obvious, and yet most of us, sort of for one reason or another, don't really use them as a regular practice. Maybe at times we'll do something particular, but as a regular baseline practice of noticing and clearing tension as soon as it comes in when we're sitting with patients, and certainly between sessions. It's important to kind of focus and practice, and to bring it consciously to mind, and then practice with sessions, because I found it incredibly helpful in staying present in managing my own countertransference, and in not building up stress such that I can be pretty fresh for long days. So this and grosser uses of breath and movement are what we'll be doing in this workshop. So I hope that's interesting, and hope to see you.